Well, hello there. This is Mark Edelman, speech-language pathologist, and welcome to the teaching of talking. And today we're going to have a very interesting discussion concerning apraxia and aphasia and what we call ear training. That can conjure up quite a number of images, I'm sure, in your mind of something called ear training. And ear training is probably one of the most important concepts in speech therapy for aphasia or for apraxia. And what ear training really is making sure that whatever sound or words the person needs to say, that they hear those words modeled by you. That you actually say those words loudly enough and clearly enough so that the individual with apraxia hears them clearly. Now, there are many people out there who have apraxia or aphasia and who have hearing loss. And therefore, the question is, what do you do when you have a person who has hearing loss and difficulty speaking and needs to hear spoken sounds and words and phrases said clearly so that they can hear it and understand it and then mimic it or imitate it? And so one of the things that a caregiver or a therapist or anyone who works with a person with aphasia or apraxia needs to remember is that they must speak loudly enough and clearly enough for the person to hear them. And not only that, but you need to be looking directly at one another, probably about 3 feet apart, so that simultaneously the person with aphasia or apraxia can see your face, can see how you shape your mouth and move your tongue for a particular word. Now, with apraxia, what apraxia is that many of the sounds cannot be produced correctly in speech. And so what happens with those with apraxia is they go to talk and the words are all jumbled up and nobody can understand what the person is saying. Well, that's because the apraxia affects the motor of speaking, and therefore when a person attempts to articulate or say the sounds clearly, they can't do it because in a way they have a motor speech problem, very much like a person who had a stroke and who has a weak leg or a weak arm or a weak hand. They can't move the speech mechanism, the tongue and the teeth and the lips and the jaw. They can't move that very well voluntarily. And so what we do with those who have apraxia is we take them all the way back quite often, not in all cases, but in the severe to profound cases, we take them back and help them relearn how to articulate, how to produce the sounds of speaking. Because for many of them, they have difficulty consciously making the sounds of speech. So how do we help a person get better? Well, they've got to hear the sound that you want them to say more clearly. They have to see the sound that you want them to make more clearly. And so it's a combination of teaching them how to watch your mouth and your tongue, and it's a combination of making sure that they hear the sound or the word. And I know with some people, I have to get their caregivers to almost speak directly into their ear so that they can hear the sound better than if they were out here 3, 4, or 5 feet away. So the process of ear training is a very important process that caregivers and speech therapists are learning and utilizing, because ear training is helping the person hear the sound you want them to say, or helping the person hear the word that you want them to say, and that you are repeating that sound and you are repeating that word over and over again until that person can say that sound or that word accurately. And so that's the process of ear training. They've got to hear your model. They've got to see the way you formulate your mouth for the sounds and the words. So that's a little bit about ear training. It works for apraxia and it works for aphasia, because with aphasia they have to hear the word and then they have to hear the number of words that you're going to help them say, whether it's 1 word or 2 words or 3 words or even more. So you can learn a lot more about ear training in our books and videos about how to help people with aphasia and apraxia speak better. So this is Mark Edelman speaking about ear training. And we hope that you've learned something very beneficial. And we also hope that you'll check us out underneath the video and see if there's anything that you may be interested in learning more about. We have a number of links down below that you can click on that will help you join our community, that will help you maybe consider an independent study course, purchase any of our books on apraxia or aphasia. So I wish you today a great day. Please remember to give us a thumbs up if you've liked this video. And if you haven't subscribed to our channel, you might want to do that. And we'll see you in the future. So just have a good day, a good week, a good month, a good year, and of course, a great lifetime. Bye-bye now.